Hello, everyone. I'm going to talk to you a little bit today about how we identify trends in pediatric healthcare at Phoenix Children's Hospital, mostly specifically to our trauma program, because that's where I work currently as a nurse practitioner. But how we identify the trends among the patients that we see and what disparities that we see, and how do we go out into the community and try to help improve outcomes of patients overall. So I have nothing to disclose to you, but some of the things we'll be talking about is how we identify these patients and understand the injuries that they come to us with and use evidence-based practice to treat them, and trends we see across the diverse patient populations. How do we communicate this, and how do we get this out into the community to do prevention work and to do outreach work amongst all the different populations that we see. We get patients from across the state, from the northern end of the state, the Four Corners area, the southern end of the state, from Mexico, from all over the state of Arizona that come to PCH that we care for that are injured from usually preventable injuries. How do we get the education out there, and what way do we reach out to the community leaders and get the word out to improve, and how do we prevent injuries from happening? So pediatric trauma is the leading cause of death and disability in children, and that's a national statistic. I think that's pretty well known. Fatal injuries account for a big portion of the population of patients that we see. Most of them are non-fatal injuries, and they end up either being discharged from the emergency department or staying in the hospital. And what is our role to those patients, and how are we going to prevent them from coming back again, from being injured again? And it's a very costly program. So at PCH last year alone, we saw just under 3,000 patients with traumatic injuries, and a lot of those injuries were preventable. So first thing that we do is we try to identify what we're seeing. What we've been really successful with in the past is finding patients that come in from certain populations from around the state of Arizona. And if we see a trend, if any of you work in the healthcare industry, you see a lot of times trends in the flu outbreaks or the Ebola outbreaks or whatever it might be. The same thing happens with injuries. You see trends, and a lot of the trends are from different patient populations. So if we notice that we've gotten this last 3-month period, we've received 6 patients from a specific area of the state of Arizona that come in with the same or similar injuries, what's happening there that's causing this amount of injuries to happen to the kids in that population? And what can we do to try to prevent it, or just try to help improve the outcomes and try to prevent them from having to come to us, because nobody likes to see injured kids, right? So we try to get the word out through doing conferences, through doing outreach events. We do a lot of education for EMS. We try to go to the different hospitals and educate healthcare providers. And then we do community fairs for the actual community members, for the parents, for the families. And those are all different things that we try to do to get the word out to people. Amongst ourselves, we continually educate ourselves. We participate in a lot of research. We have a very big research program in our trauma program at PCH. We participate in journal clubs, we host grand rounds, we do trauma M&M every month so that we can review our cases and see things that we need to improve on and what we're doing to take care of these patients. Oops, wrong way, sorry. We kind of talked about the trends and the mechanisms of injuries, and a lot of the patients that we get come from rural hospitals. So it requires some pretty significant communication amongst the healthcare providers that we're getting these patients from, because most of the time if they come from a rural hospital, or they're coming from up north or down south, wherever they're coming from, they've been seen somewhere else first, usually. So they'll get picked up from the car accident or from whatever has caused them to be injured and go to an outlying facility that doesn't take care of the pediatric patient population, and they realize that they need to come to a level 1 trauma center, so they want to transfer them to PCH. So we have to have really good communication with all of these providers throughout the state of Arizona to make sure we're getting the information that we need and make sure that we're able to help them to care for the patient until we receive them. So communication is a huge part of it, and why I think we're so good at it is because we have a huge team of people that are dedicated to care for these patients. So our trauma program specifically at PCH, we have a outreach coordinator, We have an event coordinator, we have a trauma coordinator whose specific responsibility and role is to review every single one of the patients that we see in the hospital and find things that need improvement, find things that we could have done better, find things that we did great, and find things that need to be done differently. And that's her role, to look at every single one of those patients. We have dedicated trauma and forensic social workers that work with our team and follow our patients throughout their entire hospitalization to help get them connected to the right resources once they get discharged. And we have a very big injury prevention program, which Erin's going to do a presentation the next session about. So I think anybody who's interested in that, it'll be great to listen to. And then obviously lots of healthcare providers to take care of these kiddos. We communicate with our senior leadership within our hospital, amongst each other, amongst all of our different specialties, within the community and within the cultural community, because we take care of kids with a lot of different cultural backgrounds, and we have to be culturally sensitive to all of those backgrounds. And we try to make sure that everyone is invested at all levels. I think that in order to be successful at any kind of outreach or any sort of educational prevention, you have to have people invested in it, and you have to really care. So again, it's a two-way street. It requires dialogue, it requires teamwork, it requires a very big amount of support from each other to make sure that this can be successful. Some of the things that we have done, we make sure that we take a big role in educating patients and families while they're there. I think that it's a key thing when you actually have the patient and you have the family in your facility or in your clinic or whatever it is, you have to take that moment and you have to take advantage of making sure that you start the prevention from that point. So that's something that we are really big on. And then they take what they learn and they share it with others, and then they try to expand their knowledge. And that's when you get phone calls that say, hey, we heard about this program that you guys have. Can you come teach us about it? And we're happy to do that. So we will go to any sites and try to give some education and provide pediatric-specific information to either healthcare facilities or communities, and we enjoy doing that. We also encourage follow-up, so we communicate with the primary care providers so that they know what they're looking for and they know what their patients have experienced. Prevention, obviously, is a huge thing, and I've kind of talked about that. I'm running out of time, so I'm going to kind of wrap it up. But we provide a lot of written materials, videos, equipment, and then we like to reevaluate. So we'll do follow-up phone calls with patients to see how they're doing and how they've been coping following their discharge from the hospital. How do you know if it's efficient and effective? You have to have community buy-in. It has to be culturally appropriate. You've got to be creative. You've got to get people involved. And especially if you're dealing with the kids, you can't just sit in front of them and talk. You have to be creative with how you do it. You have to be flexible. You got to make adjustments for your audience depending on their level of education, their cultural experience, and their backgrounds. You got to build lasting partnerships, which I think we're still doing every single day, and that's what this conference is all about. And take advantage of your dedicated awareness days, so like Child Abuse Prevention Month or Cancer Awareness Month. You take advantage of those sort of days to capitalize on preventing those specific illnesses or injuries. So some of the things we do, we have an EMS week where we reunite our patients with their first responders. We have a Child Abuse Prevention Month where we hold a big conference at the hospital. We go out to rural hospitals and facilities. We talk to their first responders. We talk to their hospital specialists. We talk to their hospitalists. We talk to primary care physicians. We do education that way. We do community fairs, so we get out and interact with the actual people who live there, and we try to talk to them about the things that they can do to prevent injuries for them and for their children. And this is just some of our pictures Goofy at work, so that's it. Thank you.